And she wow, dear my just away I am looking forward to this disease because it's really been a long time.
Active sex, engaging rough sex now there.
So rough sex.
Yeah.
Sex may be a rough.
Oh yeah. It's in our preventive measures, the doctor would say practice safer sex. You don't have safer sex. But between having rough sex, to say, I mean the sex is too rough, so between your cats. Rough,
I see. Is it the friction?
The friction aspect of it is very rough.
Okay.
So, and no man put me near exposed, rough, giddy, near the but check can travel. Now I find them, I'm not chew too more baby, and it's for a fact. I mean, bacteria, I cannot say, fecal matter, crab, like a baby round, what I say.
So, we should try as much as possible to do that, and then wash it down. Wash it down. Say the baby, your crown, smell it, spams. Because when you wash down, you bring it out. Oh, wash it, spams, it is a one wash it down, a woman, it's now much and the scent be ever.
The name honeymoon is like, I'll say, we'll give after for sex for a longer time. And I say, having, for actually, now, Baba engaging in that. Mostly people get that infection.
Whatever way, and I said, a dear, you bet me a dear man, a dear Yare, a come my own, the Enya side, no, my amuna, Enya side infections, no. What exactly? Like, we want you to explain more, get detailed about it. Memo, Akaba, ever health matters, Jumede, so. Higher beer, your tree, a pomodin, and common, a yamudia, a bevwire pomodin. And then so Yawahama, Yemiano, and Mano. The last time we met for the men. Fortunately, today we are here for we, the women. And then you better drink Komobia, a review, I have to say honeymoon disease. A dear honeymoon disease. Why am I in your honeymoon disease? A dear now, a Bema who said, this is what I am suffering from. Prevention methods are taking, signs and symptoms and other things. And nunti and then so your doctor come away and tell ma your doctor everything come on now church only ya don't is call now church ama yehudia ye betimi aye Shannon so say me am di dwumadi ebra me din di gifty enti come home na your doctor enkodi hu enkomo. Doctor, you are Kwaba, and that's so Eba Health Matters program is so.
Yo, Medasi, my duty, say, Mama, Queen, and that's so. I'm going to treat you. And that's why it's sweet.
Medasi, Doctor. A pie boy, any Yamiatum, Nama yet to send Yeti.
But Yamiasi.
Send Yamidi can you know. You see, your review or why you did honeymoon disease. In fact, Doctor, you're already you did know a yes, and see a baby say a dear any honeymoon disease. You can't say honeymoon disease. What is it?
Yo, but that's very brave. Now, I'm at first when I'm about 7 years from tea. Your honeymoon disease, the word is honeymoon disease. What I say, yeah, a doctor will know a friend. Honeymoon disease, mostly so it's our friend urinary tract infection, urinary tract infection, which is friend of honeymoon disease. It's which we have bladder infection.
Okay.
It's area bibinti near the honeymoon that kind of infection are going to be friend of bladder infection. You also friend of urinary tract infection, but for this purpose, we are treating honeymoon disease. I say, area go be perception wise, no. You need free abroad free honeymoon why about then when they have been mango. Now that is you know we have.
Okay, yeah, that's the doctor. And I said, yeah, say you say urinary tract infection, honeymoon disease, bladder disease. Whatever way, and I said, a dear, you bet me a dear man, no, a dear Yare, a come my own, when the Enya side Yare, no, my amona, Enya side infections, no. What exactly? Like, we want you to explain more, get detailed about it.
Yo, that's it. Honeymoon disease, some of the kind boss on area and say, it's an infection which we normally get after we recommence sexual activity when we have stayed long without sex.
Okay.
They say infection bacterial infection abra say engage in sexual activity after you stay for a longer time to go or have a sexual affair for a longer time. Now, due to the overstaying here, if their partner is not around or whatever reason, now that person has restarted as they have an affair or have sex. That person can get an infection that we call honeymoon infection. See, the name honeymoon is like, I'll say, we'll be after for sex for a longer time. And I say, having, for actually, now Baba engaging in that. Mostly people get that infection. Anytime I hear friend honeymoon infection, say, yeah, simply put, getting an infection which is caused by bacteria, and it normally occurs after while staying from sex for a longer time. Now while we're starting, you can easily get that infection.
Okay, yeah, that's the doctor. No way there, and she won't be a man. That's a way there. I am looking forward to this disease because it's really been a long time.
From the camera to
that because maybe I don't even remember the last time I had this encounter. When I said you do prevention now, I said because I think it's something which awaits me.
Alright,
the longest time says I'm years.
Oh, Jesus.
Thank you, and your doctor said you're free and you're in show year there and you're now you're better to us causes of honeymoon disease. And now why one kasa umunya saya reno.
Okay.
See, doctor, this is.
And the will be some causes before they call into causes. I'm sure I can India look say area where they go so free. Research people say we embark 3 is your man. 1 out of 3 women can get this kind of infection we're talking about before they reach age 24. Before we made 24 years, we in band me and says, "Oh, man, and son, we 24 years. Move back, everything in that honeymoon infection. I say, UTI cancer. And son, already 32 years. We in band me, you see, oh, man, and son, who made 32 years. Then move back, honeymoon infection. I say, UTI cancer. But as I said, so that should tell me, say, it's very common. Like I didn't go for it, but if you don't new, send I won't do that. So I was new, send the fire so bad. I bacterial infection, and man, but who cannot be sorry say causes then then the massa area, but it can medical say a bacterial infection. A bacteria friend E. coli, Escherichia see, I am the body they say E. coli. Now, E. coli, a bacteria, now go board in Mediano. A bacteria in my gut, the differ. I could see you soon move from your oral urina, you soon. That's where the bacteria is. Especially soon from intestines, the more bacteria different E. coli now E. coli you see the one of my videos when there is a change in the environment of the body, when there is a change in what the body needs to work, so this the friend is saying E. coli bacteria can I say no intestines but when they live there if you don't find a way in the urethra, maybe the edges suffer now. No more blood anymore, no reversing this kind of infection. So, maybe it's a initial how does it have with sex? Then, when the bacteria finds its way in your urethra, or drones finds in your bladder, then they will cause this kind of infection that we're talking about. And that also means, so, a medical kind of bacteria, as I know. This bacteria is in the urethra. Can be the first one, or your guts in the moon. Can the first one close to, and that's what urethra because get at the back. Yes, it is a man net by nature, when I say, or moon, let's say, the vaginal orifice, and their urethra and their vaginal orifice and their anus, some are very close. And I can say, or more urethra, I get blood now, you find a first one with the Jones find urethra, some it's not coming. Very short, very short as compared to the member, and it's very close to the anus. What I said, and to the vagina. Inti said through any means, any activity, let's say this bacteria to any way, a bar or gets close to the orifice of the vagina or the urethra, whichever, they can easily enter. What I said, it said, since by nature women have this shorter structure of the urethra, any closeness of the urethra to the vagina and the anus. Bacteria easily find their way around that area and they enter the urethra.
Okay.
But what I say, and about the survey, and also the presence of the bacteria in the bladder, then they get way and they start to cause the kind of infection. That also means acts of sex.
Okay.
We go on anal sex, active sex, engaging love sex, and
bacteria. So rough sex.
Yeah.
Sex may be a rough.
Oh yeah. It's in our preventive measures, they say practice safer sex.
Okay.
You don't have safer sex.
But
between having rough sex, to say, I mean the sex is too rough sex, so between your cats, between your
rough as in, is it the friction?
The friction aspect of it is very rough.
Okay.
So and no man put me near exposed, rough, giddy, near the bacteria can travel. Now I find them, I'm not chew too more baby, and it's for a fact. I mean, bacteria, can I say, fecal matter, crab, now a little round, what I say, into your friend in all those types of different processes. Into that kind of sexual activities, it's me, we introduce bacteria from where they are naturally supposed to be to where they are not supposed to be. And the moment they have changed their setting, they will cause.
That's just say, doctor, say, make sure I look at crab. That's just say, and more one eye and cook boy, a big free baby, aqua baby, I so once not if you're not a young man, no, what's not your people, that's I don't
know. It's what the previous videos are. No, my church area, change in the environment. And changing the citizens in the environment. Okay. If they don't get what they need, they will cause it. Bacteria will have that inner side. And lastly, on the process, we have some contraceptives that we use.
Okay.
Some contraceptives we use they help in the introduction of the and with me fat. One be and as a microbes and as a bacteria, if they be not a baby, then at the end to my inner bacterial infection and honeymoon disease. Remember, you better call more into the contraceptive.
I can't come with some questions, but I will say I'm remembering my opinion. Yes, to walk because contraceptive once a year. Yeah, youth, especially those teenagers, from that within 16, 17, 18 for they really need to be educated on our contraceptives. Okay. Thank you, Dr.
Lastly, on that there is some use of contraceptives you care for the hygienic ways now. It means to receive bacteria into. So the concept of this honeymoon disease, introduction of the bacteria from where it is naturally supposed to be to a different, and most especially this case we're talking about when it is in the bladder.
Okay.
When it is in the bladder. And so we start very fast for the bladder. Sana, wait to be attitude.
Thank you. Dr. Emma Education Bebre. I hope say a dear Biara Wutieno, point, jotty be down. You should write something down so that Ubria, now who says, say any semi and see the signs and symptoms. You better also signs and symptoms. Doctor said, Obinya honeymoon disease now. die ashenso die no be hu a beka say oh because of side waiting I think I have an infection or there's something wrong with my system.
Yo, signs and symptoms and am you like perhaps that you can say your man who be about deity or wedding and that's what we do. It's in every deity any you any kind of mostly people a lot of ladies experience this. You feel frequent a very frequent urge to pee.
Okay.
That's not what you know.
Okay.
Urge is a very frequent and it's very strong. That's how we do. That's how we do. And you said you must say the urge is very strong and very frequent to pee. That's how to relate. It's always there. Oh man, then the urge is so strong that one person will say, but I can't
Pregnant woman.
yeah, I said, what I said. And not two, that Johnson and Ellison person with Johnson. And yes, the best person with Johnson, you prefer the burning sensation. It's fact, they didn't kind of Johnson come. The council account is and that. The DH is a person with Johnson, what you say, it's so pain. Oh, these are the basic signs and symptoms when you're UTI and that's when you're honeymoon infection. You know, a lot of UTI, and I say UTI, but this particular one is the one that people get after they restart sexual activity.
Okay.
That the same as a UTI now. We all to we say we do so and that's the kind a lot of ladies experience that, and mostly before they reach age 24. Now I experience that symptom. The frequent and the strong urge to urinate, and even if you urinate, it's very pain and burning sensation. And you're afraid, I remember you must know, all go through a UTI and that's a honeymoon disease.
Thank you very much, Doctor, for this one too. But Doctor, Mr. Namabusa question, Kakra, me patrol, we were one man. Or having sex is not like so having sex ni be ache and I say be the first time but ebia my having sex and then by 3 days time so me kodunsa me feel say dunso ne wuki kame emu ya me ya emu nya me normal urination and also we be classifying as being
oh say there so far as we won't change in your environment my dear which I can say between that you will say which are infection.
Okay.
Because like a cow and yana there. So UTI, apart from say we have a sex action, now they have it's there for anybody because the inner is that we know what causes it. And yes, normally like sex now 1 year change now, you know when next the introduction of the bacteria from one area to the bladder. You see, which I say bladder have sex, which I say they don't have sex, but there has been an introduction. Until this time they cry and within an hour or less in 2 or 3 days, 2 days, not that if feeling signs and
so doctor, can we base on this? Now you blame your partners when we have infections.
Oh yes. So and again because of the cause of it. If it's out from your partner, maybe the bacteria your bacterial infections for all. Okay. Your bacterial infections for all. Instead if it's a bacterial infection we're talking about, and it's not this E. coli. Okay. Come out they are fine. What I say. So having infection can be from the partner. We can get it elsewhere. Then you're okay, what if it's not sex? What if it's not sex but through you? One person manipulating the area or putting yourself out maybe not going to resume maybe from baby to baby. What I say.
Okay,
yeah, see the cause now, whether it's from the guy or it's from the woman or whatever.
Okay, natural says there are lots of infections, bacterial infections, viral and then fungal infections. But this particular one we are talking about, so we're abstaining E. coli, that is the gene, we're abstaining for long. And the amount of infection way, and yet other ones known how the baby show we say, and you wait na aye. That's CP doctor for this one too. And she said, Obinya E. coli infection, yes, I bought away every baby. I didn't know a better baby and treatment, Papa Bang, and I bet me because a my dear said your kind of baby. Now no go raw would say sometime. Now I cover some cassia be at your bro. Into treatment then now you bet me enya ama yet it's me a wine your home at 20.
Yo, I would say normally when you get infection, the only best way to use prescribed, the word is prescribed antibiotics of your bacteria, so antibacterial more inbred more from antibiotics. But the problem is prescribed. Obi one man dey kusa ye Kenya or infection na any nearby drive store and I said I don't want to just but now memory now and there's something that one day we'll talk about it. Your friend antibacterial resistance.
Okay.
Just say ya emboa na mo cause yare no. Ya mo ya sense on and I say I'm strong. Now I'm strong. Nti na me cut saka say prescribe the time yeah we should do vigorous investigation, know the correct cause of the infection so that we get a prescribed treatment for it. Nti oyare na and so say we na cut a good job na no or need more what you say. Nti for this particular treatment, you need a prescribed antibiotics. We call prescriber and so call hospital. They can give you a prescribed. And before they will do this, you see, they will investigate the medical collab. No. Seven collab, you put the exact. You are just buying a lot of drugs, which. As I said, most of the time, when you say of late, you say once na crowd oh, house line.
Yeah, so you need to market.
Yeah. Particular crowd, what is one man? Yeah. But when you have some mosquito crowd, it will just push away the mosquitoes, but house flies will be around. Okay. I hope you get it. Yeah. It's about treatment of infections and never before beginning infections upon infections, they don't get the prescribed. And most of before we get the prescribed ones, lab, swab, and you say possibly. So let's give this drug. But if you can't drug the most one, not I say environment. That will be about not for you. It's number one of the count treatments, you have prescribed medication as a prescribed antibiotics. Number two. The only thing that they can do in addition is they don't want pain relief because who chose that area and they don't want pain analgesics and I said pain relievers. In addition to the antibiotics, the whole antibiotics now they are prescribed I go for pain so they have pain now when they choose alcohol. Until so will be sad and can't meet me I mind who that pain relievers you are a sign but component to me that's why inflammation. Inflammation of the bladder. Because bacteria I don't cause infection about inflammation about you have to pain relievers and anti-inflammatory drugs. Your home remedy is to speed up when you get this bacterial infection. Drink a lot of water. Okay. Oh, drink a lot of water. So we why? Because who knows we now will choose so we never flash out the system. Now juice of a brain. What I say? Juice of a brain. The last time I come here, maybe a friend of probiotics. Okay. I have a video on that. You can check my previous video. Probiotics, foods that help the vaginal health. Okay. The friend probiotics. Probiotics here. Nyankopon bo mba na kasa no. Odi mboa bacteria na say we are microbes here no. Nyankopon kasa the natural ones. Ebuye vaginal orifices wo a healthy microbes. We are healthy microbes and Nyankopon do answer soja fo a Nyankopon do mu ko no a no mbo ye ho banya ade. But there is an environment that we should create for them or they be healthy. What I say? It's an environment no and creating no amount say you know a journey obedi by different probiotics. You probiotic drugs, you probiotic foods. would dear Boama environment naturally. A boy to be fighting for infection. So, to one of the preventive ways, I encourage everybody to take probiotics. If you are rich in probiotics, you can just find out in my son account, I will video on that, which I'm checking. Probiotic foods. No, we are now vaginal health. I am successful.
Okay, thank you very much, Dr. Ward. Yeah, I think many say no problem, and yes, say about walking to the pharmacy. They are put to a dry your pet. Young hospital or moon test, young labs. Now, what exactly is the problem now? Or mama treatment. Okay, doctor, say very free her. Treatment or real on the preventions and see preventive measures bank and I bet me are taking as ladies, as women, and my yenya problems, yenya issue so be a dear how a better brain actually.
Yo, I would say, I think I may can't be required now if you say you're very with people real. One thing is a matter in manager's submission, safer sex. Let's try as much as possible to practice safer sex. We are not discouraging anal sex, we are not discouraging any form of sex. But before you ensure there is an entrance or something enters somewhere, it is very clean. That's one. So because of safer sex, every rather baby, say it's very clean. Or every baby bam. Every baby bam. Baby every bam. But every bam are very clean. That's not very good for her. They can't do that. Whether any form of sex that you are engaging in, make sure it's very safer. And any one of the ways. And number 2 years, you try to pee. And you try to engage yourself after sex.
Okay.
Most of the time, who have sex, we are trying to always say, very true so that at least we bring some test out. If the people want my argument, I bet that and maybe some also ask that you wash. After every episode,
hey, you have to
wash down so that because some of the one of the last me a video that says I'm interview was like semen causing infection. When we go and do so, it's standing there. It will not a bowel to know the infection. So quickly after when you have intercourse, you can wash down. So 2 days then drink plenty of water.
Okay.
Or plenty fluid. It's the cover the fluid, which more drink and energetic ones again. The last now still add is take probiotics.
Okay.
Not more bacterial infection. Because you can't do all this, you can't talk without talking about the before. Somebody said, you better deep in branding, she said, I will ask my safer sex. Everybody to me. I don't so be brave. Now, yet me, I do so be brave. Now, I read a honeymoon disease, and as a UTI, as any kind of urinary tract infection, I buy up and very brave. It means access to unless you are brainless.
Doctor, yada wasi bebre wo emra na so wenya na woni yen abeche adusua e wa komudin kase ho a eti sei me nuanom mba ye nyina yete dia doctor e kan ye hwe say ye be practice safer sex very very necessary and then wo bedroom so we ye tatata ni wi a wudi idea we are making sure say we bedroom so to bring out everything and what to prevent unwanted pregnancies though. So bedroom so you bring out the sperm too. So we should try as much as possible to do that and then wash it down. So the baby your crown smell it sperms. Because when you wash down, you bring it out. Oh, wash it be sperms it is a one wash it down, no woman it's now much and the scent be ever. Yada must be brave. So what to me a young bread and the tier programming. And my friend said, me and did you a day every week, your friend me gifty. Now my friend to say, we have social media handles in our health matters. Now I call like him, what share, what subscribing, what posting on your status to educate those who couldn't listen. And see, I have na emre ebema pine, my did you median ebesi. Macron.